Imagine this. You wake up feeling perfectly fine, but by lunchtime, a sudden wave of fatigue hits you, followed by that telltale shiver despite feeling warm. You might wonder, is this just a passing bug, or is something more serious brewing? When it comes to influenza, or the flu, yes, fever and chills are often among the very first symptoms to appear. They typically strike quickly and intensely, serving as a clear signal that your body is launching a full-scale defense against the invading virus. The reason these symptoms are so prominent and rapid is all about your immune system's immediate and very efficient reaction to the influenza virus. When the virus invades your respiratory system, your immune cells, like vigilant sentinels, quickly detect its presence. In response, they unleash a cascade of powerful chemical messengers known as cytokines. These cytokines are crucial for immune communication, and some of them have a very specific job. They travel directly to your brain, particularly to the hypothalamus, which acts as your body's internal thermostat. Upon receiving these cytokine signals, the hypothalamus effectively resets your body's temperature set point to a higher level. This elevated temperature is what we experience as a fever. It is not just an uncomfortable side effect. It is a strategic defense mechanism, as a warmer internal environment can make it more difficult for the virus to replicate efficiently. The accompanying chills you feel are your body's attempt to generate more heat to reach this new, higher temperature set point, often through muscle contractions and shivering. This explains why flu symptoms can feel so sudden and overwhelming, as your body instantly shifts into a high-gear battle mode. Recognizing these sudden and often severe initial symptoms can be incredibly helpful. If you experience a rapid onset of fever and chills, especially during flu season, it is a strong indicator that you might have the flu. Knowing this early can empower you to take immediate steps like resting, hydrating, and considering isolation to prevent further spread to others. Beyond the initial fever and chills, the flu often brings with it a broader constellation of other symptoms that can appear just as quickly, sometimes within a very short window, typically 1 to 4 days after you have been exposed to the virus. These frequently include significant generalized body aches, pervasive muscle pain, a persistent and sometimes hacking cough, and a raw, sore throat. It is important to note that this rapid and intense onset of symptoms, particularly the high fever and pronounced chills, is a critical distinguishing factor from the common cold. Colds usually develop more gradually, with milder symptoms that rarely include a sudden, high fever. The flu's abruptness and the overall intensity of symptoms like fever and chills are key markers that can help you differentiate it from other respiratory illnesses. Understanding that fever and chills are frequently the initial and rapidly developing signs of the flu gives you truly valuable insight into what is likely happening within your body. This awareness empowers you to distinguish influenza from other milder illnesses, and critically, it allows you to take proactive and timely measures for your own recovery and well-being. By recognizing these early indicators, you can ensure proper rest, stay well hydrated, and, if necessary, seek medical advice promptly. This proactive approach not only supports a quicker and smoother recovery for you but also plays a vital role in preventing the potential spread of the virus to others in your community.